Did you know that having mental illness does not take away your human rights? Today, let us look at the rights of mental patients. One, they have a right to dignity and respect. So every person with mental illness has to be treated with human dignity, respect, and compassion. So there is no need for you to abuse them physically by torturing them, by abusing them, by emotionally abusing them, or abusing them sexually, or like in the example of rape, defilement. And also there is no need for you to treat them in a way that is not required. What do I mean? Like taking them in experiments, like let's say people are trying out some medicines in the laboratories, to take them in the laboratories and to make sure that maybe they take part or in those kind of experiments. So then right number two, have a right to access mental health care and must be assessed by qualified medical personnel, like let's say psychiatrists, psychiatric clinical officers, the psychiatric nurses. So they may not be taken to other places like the shrines, and where they are tortured. Maybe they have taken some parts of their private parts of the body. Then also under that, they have to be treated in a hospital and also in a community. They have to be given emergency care when needed, and also when after treatment or maybe after discharge, these patients are supposed to be followed up. Okay, that is under right number two. Then right number three is that a right to informed consent. Okay, so no treatment should be given to mental patients without consent. So as a health worker, or as a person who has a mental health issue, is that the health workers must explain to you the diagnosis, the type of illness that you are suffering from, the medicine that are available, and their side effects. So you have a right to know which condition you are suffering from. You have a right to know what is the diagnosis which the doctor has given me, and also to know about the side effect. This should be voluntary. The patient should not be forced, and also the person has a right to choose freely without being what? Without being forced. So, but in cases of psychiatric emergencies, that is whereby you can get a consent from the relative or a caretaker who has brought the patient. That is when the person is not able to decide, or when is not in the right mind to make up what? A decision. That is the right number three. So number four, right to restrictive treatment. So these people should be treated in an environment which is not restricted. Okay, we have had cases of where patients are tied in houses, people are tied in certain kind of settings or in rooms, but we are saying that these people have a right to be treated in a less restrictive environment. And as the mental health profession, we prefer that these people can be treated in the community more than in a hospital setting. So the best management of mental patients should be done in a community setting, like not institutionalization. Institutionalization is where a patient is taken to a hospital and kept there away from their family. So these patients can be treated from their community. Why do we need them to be treated in their community? In that, when someone is treated near their home, their village, they can get what we call social support. Their relatives can come and visit them. They can come and encourage them to receive treatment, and this one helps them in the healing process. Okay, but when you keep someone in the hospital, like for example in Uganda, in Butabika National Referral Hospital, you find that this person will be worried about the family. He wants to go and see the family, cannot access it. So you find them, the healing process takes long. So we prefer that the treatment can be done in a community setting or in a facility which is near their what? Their community. Then we are talking about seclusion, is that there's a times when patients become so violent that even when you give them our medication, they cannot be managed. So we say that there are times that we have to keep them in maybe side rooms, a room which is specialized to keep those guys, where they cannot commit suicide. So they can be kept there for a short period so that they can calm down. So we are saying that this should be the last resort. They should not be kept there as the first option. Okay? Then also we avoid this thing of keeping, tying, locking these patients in houses, in homes, in places which are not needed. That's what we are saying, right to restrictive treatment. Number 5 is the right to freedom from discrimination. So people with mental illness should not be discriminated against in employment. Okay, like when you are employing people, then you start discriminating and say this one has a mental illness, I cannot give him a job. So we are saying that they have a right to get jobs. Then also in education, we find that maybe in a university, you don't want to admit these people in schools because they have a mental what? A mental problem. That is called discrimination, and we are saying they have a right from freedom. They have a right to freedom from discrimination. Then also in marriage, they should not be discriminated in terms of marriage. When someone wants to marry, you as a religious leader, you should not stop and say, you have a mental problem, you are not supposed to what? To marry. Okay? Then also they should not be discriminated in housing. That you as a mental patient, you don't need to be in a house. Okay? Then also in community participation, you should not discriminate these people in community participation. For example, when people are going to vote, you should not again discriminate and say, for you have a mental problem, you have this and this, therefore you are not supposed to take part in the elections, or you are not supposed to take part in this celebration. That is, there you will be violating the human rights, the rights of mental patients. Right number 6 is right to privacy and confidentiality. That the mental health records or mental health information should be private and should be protected. Okay? The diagnosis and their records should be kept very well unless the patient has given you an informed consent to share their information with other people. So what are we trying to say is that the information that you get from these people when you are interacting with them, when you are diagnosing them, you should not share it with other persons unless you have gotten a consent. So there are instances where you can share the information with other people. For example, as LSA workers, if I'm the one who is managing this client, I have a right to share this information to a fellow colleague for the case of treating this patient, to understand what the problem of this client. Then also sometimes is in courts of law, they may ask me as a health worker to share the information about this client. So there, in those cases, as a health worker, I have that right to share the information about what? The client. So we are saying that right number 7 is right to participation in treatment decisions. So mental patients have the right to take part in decision making when you are giving them what? Treatment. So they should be able to understand the treatment options. They must be allowed to ask questions that now you are giving me this medicine. How is it going to affect me? Okay, how is it going to help me? Okay, so they have a right to take part. Say if they say, for example, you want to give them injections, but they are saying, for me, I don't want injections, I want tablets. So you have to respect their autonomy. Okay, so you have to respect their decision making. Like if someone is able to understand, but in case someone is not able to understand at that moment, then you have to seek a consent, or you have to involve the caretakers to take part in making a decision on their behalf. And also they have a right, under this they also have a right to accept treatment or to refuse what? Treatment. So as a health worker, you have to explain the treatment options to the client, and also to help them to make an informed decision. if you are new to this channel, I request you to subscribe, like, comment, and share with your friends and social network, because this motivates me. Number 8 is right to protection from abuse and exploitation. You know, when people get mental illness, they can break down, and you find that people can take advantage because they are not able to understand well, they are not able to make better decisions. So we are saying that these people have a right to be protected from sexual abuse, from exploitation, from forced labor, and also from neglect. So neglecting someone at home is violation of their rights. So the people that we see in the streets moving around is because the family members have violated their rights. So these people are not supposed to be neglected. Right, number 9 is right to legal representation and appeal. So mental patients have a right to appeal in the case of what we call involuntary admission. So there are times when these patients are forced to be taken to mental hospitals by force or against their will. If you be in Uganda, we have some two types of admission. There is what we call voluntary admission and also what we call involuntary admission. So voluntary admission is where a patient comes by themselves and say, I am sick, I am having maybe this problem. Okay, that is voluntary. Then involuntary, it can be a case maybe where the court says so and so, maybe John is having a mental issue. Please, can you keep him in the mental hospital for 2 weeks as you examine and assess him, and you give us a report so that he can come back to his mind, then he can understand maybe the case that he has committed. So that is under what we call involuntary admission. There are patients who are admitted in a mental hospital by what we call minister's order. So maybe they have violated some rules, then a certain minister has signed that this person should be kept in a mental what? In a mental hospital. So these people have a right to appeal that against that. Okay? In case they are understanding, they are capable of doing that, or they need to have lawyers who can stand in for what? For them. Then also the last one, number 10 is right to community integration and rehabilitation. So these people have a right to return to their community after, for example, there are people who commit crimes and maybe they go to the hospitals and they are treated. So they need to be reintegrated in their communities. They need to come back to their communities to receive that social support and also participate in the community what? Activities. So if you say that this person doesn't need to come back into our community because of having a mental problem or because he killed this and so when he was mentally sick, then that one is, you are violating the rights of mentally sick what? People, because they have a right to community integration and rehabilitation. Then as they're in the community, they have a right to access what we call rehabilitation services. It can be substance abuse, it can be these other normal sicknesses, the mental illness where they have to be accessing the health workers to go for treatment to help them regain back their skills that they lost. So they have a right. If you are new to this channel, I request you to subscribe, like, comment, and share with your friends and social network, because this motivates me to make more videos. So as I finish, we are saying that mental illness is not a crime. Mental health is a human right. Protecting rights of mental patients promotes recovery. Okay, so thank you so much for watching my video. If you are new to this channel, please subscribe because it motivates me to make videos. Thank you so much. See you in my next video.